My name is Sylvia Patillo, and I'm the Freeholder Deputy Director. And I want to thank you so much for coming this evening. The information that we want to give to you is in many cases, information about life and about death. And I'd like to take a few minutes to explain why we put this drug symposium together. It started when I received a phone call from a very dear friend that had just found out that her daughter had committed, I guess, had been found with drugs, and she had overdosed. They were able to bring her back with the Narcan. So she was in the hospital at the time, and she was trying to find some type of a Christian counseling recovery center. So I was able to get in touch with Teen Challenge. I had some connections with Teen Challenge. It took me about 2.5 weeks to find a bed for her for recovery in Alabama. So when I called my friend, I said, I have the bed, it's in Alabama, let's get her on the plane, they're ready to receive her. She said, it's too late, Sylvia. She said, she doesn't think she needs long-term care anymore. She's feeling well enough that she thinks she can handle this on her own. Well, a year later, she died of an overdose. So I came to all of our staff and our actually people here with so much experience from the county, and I said, we really need to get information out to people. So when something happens, they know who to call immediately. That was the problem. My friend did not know who to call. She called me, but I did my best. I couldn't get her a bed any sooner. But we have people here that know how to give you the information you need, know how to give you the resources, the phone numbers, and can get you into a recovery situation faster than anyone I know. So we are planning tonight to speak to you about all of the services that we offer in Sussex County, and we're going to give you, when you leave, a card, a piece of paper with numbers, so you would have something in your hand to either put on your refrigerator or place somewhere safe, that God forbid you ever get that type of a phone call, you know who to call immediately and get into the services that you need right away. So tonight's a really important night, and although these chairs are not filled, take the information that you learn and please spread it around to others in your community. It truly can save a life. So thank you.
Good evening, everyone. I'm Carol Navarrete. I am the Administrator for Health and Human Services, and I'm very, very happy that you're here. As the Freeholder Deputy Director said, we have some very important information we want to share with you. We also want to hear from you as well. But as you're hearing the information, there's 3 questions we have up here. We would like you to think about them. First question, you find drugs and or paraphernalia in your kid's room. Who do you call? Someone you love has overdosed. What do you do? Someone you know is using drugs and won't go for treatment. What help is available to you? We're going to answer those questions for you tonight, and we're going to give you the information that you need just in case, because you just never know. As the Freeholder Deputy Director said, she had a friend, she didn't even know her daughter was using drugs, and she got a call. And so you just don't know. It could be a friend, it could be a family member. It just happens. It happens. I just want to say that we've got a very distinguished panel with us this evening. And, so what we're doing tonight, we're coming between the state and the county and the prosecutor's office, police, and local service agencies here as well. And we're going to offer hope this evening for anyone who is struggling with addiction. So let us face the addiction issue together as a community and not alone by ourselves. Our first speaker this evening is going to be Prosecutor Francis Koch, who has lived in Sussex County almost all of his life. In 2014, he was appointed prosecutor, and since then he has been a vocal advocate for a different approach to the opioid epidemic for law enforcement. His office has provided Narcan kits to each police department in Sussex County to be used to save the lives of people who have overdosed. He's also one of the key leaders of the CLEAR initiative, which you'll be hearing about later in the program. He really is an incredible prosecutor, and he's really done a lot of good for people who are suffering from overdose problems. Anyway, prosecutor.
Thank you. Thank you very much. First, thank you all for coming this evening. Again, it's not a giant audience, but the idea is for us to give information, for you to learn a few things about today, about the services that are available. You are able to share that information with others, because it's the only way we're going to be able to address this issue. It's not a law enforcement issue only. It's not a service provider problem only. It's only by all of us, the community, law enforcement, the recovery coaches, all of the providers, all of us working together to be able to solve this issue. The opioid epidemic, which I'm sure you've all heard about, it's prolific. The numbers of deaths in the United States is astounding. In 2016, we lost 64,000 Americans to overdose deaths. In 2017, we lost 72,000. It's 197 people a day. And to put that into a little perspective, during the Vietnam War, we lost 54,000 Americans. So we're losing more people by the substance use disorders each and every year. And it's something that we need to address. And it's not just a national issue. It's not just a state issue. It affects Sussex County. In 2013, we had 13 overdose deaths. By 2016, it was 36. That number has sort of leveled off over the last couple of years, right around 36, 37 over the last couple of years. But that's 36 or 37 too many. In 2014, as it was just mentioned, we started to give Narcan to the law enforcement officers so that each and every police department in this county, every patrol vehicle carries Narcan in an ability to save lives. And in fact, in 2015, we were the first, and we still may be the only county, but I know we were the first, that every single patrol vehicle carried Narcan. And those numbers, where did we have in 2015? There were, I think, around 50. By 2017, we were up to 146. That number, if you take a look on the website, the CARES website, you can see it on the Attorney General's website or the Division of Criminal Justice's website, and it tells you actually throughout the state the number of Narcan or overdose deaths in each county and then total for the state. But those numbers are only law enforcement and EMS numbers that get reported. In today's day and age, we have many, many more Narcan deployments going on that we are not aware of because of the training that's going out. I know that the Center of Prevention and Counseling does trainings where the free kits are given out. So parents, friends, they have these kits and they may be administering them to overdoses, so we don't know. So that number that we have right now is a little misleading. But again, the whole purpose behind this was to save some lives. And to a large degree in debt, we are all in debt to Becky and Mike Richards, Chief Richards from Newton, with regard to what can we do? We're saving people's lives, and then they're going home. And then they're coming back, and they're having another overdose, maybe 3 months later, maybe 3 days later, maybe the same day. But they're not getting information for help. So the idea was, let's give them a pamphlet. And Mike's going to talk about that because that, and Becky, because that pamphlet turned into the CLEAR program. And that CLEAR program turned into recovery coaches, and turned into an ORP program, and turned into Helping Hand, which I'll talk about later on. But all these little steps that we are making to try to save lives and what we have done. You know, most people have this, at least they used to have this misconception of people that are heroin users, that it was a choice and they're always chasing to try to get high. Well, we've learned through our studies that approximately 80% of the people that have a substance use disorder related to opioids goes back to a prescription from a doctor. That's how they started. They started with a prescription, listened to their doctor, and by the time they were done with that prescription, they were addicted. And why is that? The average human mind becomes addicted to a drug, or at least with opioids, within about 20 days. There's a rewiring of the mind, and the mind needs the drug, and it drives for it. And we can see what a powerful draw this has, or control on people's lives, because they know there's deadly forms of this drug that they're buying from people off the street, yet they're willing to risk their lives just so they don't feel like the hell that they're going through. So that's what we had. We had doctors being told that first that opioids were not addictive, and hydrocodone, that's probably the number one, that it was a miracle drug. First of all, it solved pain, and it took away, there was no addiction. Well, we've all learned that's false. And we've learned that this is probably one of the most addictive drugs that's ever been out there. And the United States was particularly hit hard with regard to hydrocodone. Hydrocodone, again, is just a drug with regards to pain relief. And the United States was the number, I'm going to give you a year, I think it was 2015 or 16. I got this from the DEA. We were the number one prescriber of hydrocodone in the world. Number 3 country was Germany. And they prescribed 60 kilograms of hydrocodone in that year. Canada, our neighbors to the north, they were the number 2. And they prescribed 100 kilograms in that same year. And in that same year, as I said, the United States was number 1. The United States prescribed more than 79,000 kilograms of hydrocodone in 1 year to the American population. 99.5% of the world's hydrocodone. That led to where we are today. Our addictions, our epidemics, our substance use disorders. Now the good news. There's a lot of good things happening with regards to this, stuff that has happened. Again, the Narcan program, not just law enforcement, not just EMS, but you're able to get the drug, learn how to use it to be able to save someone's life. We have the limitation on opioid prescriptions in New Jersey to 5 days, and that's incredibly important because in 5 days you do not become addicted to the drug. If you need it more, if you have a chronic pain issue, if you're in stage 4 of a cancer, of something that needs pain relief, we're not trying to keep it away from people who need long-term pain management. What we are trying to do is stop people from thinking they need it or becoming addicted to the drug. We have the Prescription Monitoring Act now in Sussex County, in New Jersey. And in fact, almost all the states have now signed on. At first it was only a few of the states, all the states surrounding New Jersey, and now I think it's about 36 throughout the country. But every doctor and every pharmacy, before they can give out a prescription, has to look at the Prescription Monitoring Initiative, and they have to see, is a person going to multiple doctors, multiple dentists, across state lines to get prescriptions for different ailments to be able to feed their addiction. The Opioid Protection Act, where people, if you're in the midst of someone who is having an overdose, you can call the police will come. They don't care if there are drugs there. The purpose is to save that person's life. And there will be no criminal charges with regard to possession or use of those drugs. We have turn-in sites in 9 of our municipalities where you can turn in drugs. And the important part of that is you're taking the drugs out of the system, out of the temptation of people to steal them. Children, friends of your children's friends that come. Open houses, real estate agents, where people go into people's bathrooms and open their cabinets and take drugs. This way we can properly dispose of them because they go into a receptacle and the police turn them into the DEA to be destroyed of properly. Those are some of the steps that we have taken. Those are some of the things that we are doing that are positive. And I want to introduce now Becky and Mike with regards to the Operation Clear. I consider myself blessed They started this program, but they brought me in from the very beginning, sitting down on these initial meetings to make sure that our community was working together to save lives. Thank you.
Thank you, and thank you, Francis. We certainly were glad to involve you in the very beginning, because who wouldn't want the county prosecutor on their side when you start something new, along with people like Joe DiPaolo from Newton Medical Center, right? We had all the stakeholders involved, and sometimes people are saying, like, why is the police chief up there talking about the CLEAR program or a drug problem? That's there's treatment facilities available for them. So sometimes it's actually a good place to start, because everyone benefits if you help somebody struggling with addiction, because addiction is both a public health and a public safety problem due to there being so much criminal activity that is associated with drug addiction. So it really is something that serves everyone when we reduce drug usage. So just as a little bit of a timeline, we started using Narcan in 2014, and then in 2015, now we're using Narcan more and more, and we find that we're going back to the same place over and over. And we felt like there really is something more that needs to be done. It's just not enough. And it felt like shaking somebody and saying, you almost died, now what? There's got to be something else. So that's really what kind of spurred that. And what we found when I met with Becky and her team, and we had the prosecutor, and we had all the stakeholders from throughout the community there, and we found that just that act alone was really one of the first success stories of the CLEAR program, because there was people such as at the hospital passionately trying to help the opioid epidemic. Certainly police officers were doing everything they could, but the tool that they had was arrest, right? And certainly we had prevention and treatment, all doing everything that they could. But what we found is there was a certain extra benefit to the synergy of everyone working together. And I think that's really the best example of the CLEAR program, the Community Law Enforcement Addiction Recovery Program, that is the best outcome. So by giving a police officer this extra tool in their toolbox, they now had something additional that they could do when they encountered somebody with a drug problem. And one of the key things that I think we have here in Sussex County, because everything needs to be fine-tuned to the area that you live. If you look at the numbers, Sussex County really has more of a demand problem than we do have a supply problem. And just like basic laws of economics, if you reduce demand, then the sellers go someplace else. So everybody's going down into Patterson and Newark to get their drugs. If they're not going to keep selling them here if we reduce demand. So the way that the program works and how it transpired is we really needed to get all those stakeholders together. Newton Hospital was absolutely very important, and we had to do a lot of fundraising, and we were eventually able to get our coaches trained in CCAR, and we ended up with family coaches on top of that, which was a huge benefit, because sometimes someone wouldn't voluntarily come into the police station until their family learned how they could guide them in that direction. So in July of 2016, we started accepting participants into the CLEAR program. We had things in place so that they could come into the Newton Police Department. It wasn't long after that there was a total of 9 police departments across the county that also signed on and could take participants into their police department, screen them for the CLEAR program, get them connected with a recovery coach, and oftentimes, if they needed it, we could get them right into a treatment place. And that is regardless of their ability to pay, whether or not they have insurance or anything. So this CLEAR program, what it did was it got everyone to work together. We had quarterly meetings where we discussed things, and we developed relationships with treatment providers, and with that is really kind of a one-stop shopping experience. And we could also have a lot of follow-up with them to help maintain their recovery. So that's what our coaches do, and they're really the key to this. And one of the things that Dr. Brutico says when he was here in some of the other symposiums we had, he mentioned that someone overdosed and they're in the hospital, that the last thing, essentially the last thing that they wanted to hear from is the guy in the white lab coat and the stethoscope telling them how they need to fix their life. And the same goes for the guy in uniform trying to tell the person that just overdosed. They don't want to hear that from us. They don't care what we have to say. But when it comes from someone that's a peer, someone who has lived experience, someone who can say, I was there, I was in your shoes, or I was even worse than you, and I got better. Now that really is effective, and that makes a big difference. So the other important part of the CLEAR program is by giving this law enforcement officers this extra tool in their toolbox, right? It gives the public another way to see police officers. Our relationship is less adversarial, right? So it really has been a benefit to police departments, I think, and it's been very destigmatizing to addiction. And that's an important role, I think, that the CLEAR program has fulfilled, because by destigmatizing it, it also promotes people coming in to seek help that much easier. So from the beginning, there have been over 100 people who've contacted the CLEAR number or has come into a police station and they've received help. And when a police station is one of our members, so to speak, throughout the county, that means that not only will they intake a participant, but it also means that their officers have all been trained in the science of addiction, and they've been trained on how to make a referral and how to help people. So they are better understanding officers as well. And as you know, as you likely know, Sussex County has about half of the county is covered by the New Jersey State Police, and they're also on board. So the troopers, while they're not an intake location, we're training all the troopers so that they're aware of the CLEAR program and how to make a referral. So I think it's also one last important thing to mention is that we've also been taking our show on the road a little bit. Because if Sussex County is doing good things, like the CLEAR program, but Pennsylvania, just north of us, they're not doing anything, that's actually kind of hurts us. So we've gone to Pike County and we've spoken to a task force up there. Warren County has started their own CLEAR program. So there's other areas near us that are doing very similar things. Morris County has their Hope One van, and they're associated with PARI, which is one of the organizations that we first kind of became affiliated with. So as the drug problem in Sussex County and the region really evolves, we're going to continue to adapt with that, just as fentanyl has made the opioid problem even more deadly. We're continuing to do more things, grow the program, and Becky and the prosecutor will speak about some of those additional things next. But I just want you to, if you could, I'd like you to go to the CLEAR program website, take a look at what we have on there, open up the annual report and check it out. There's a lot of great information in there, and I think, like the 3 questions that we started the program out, there's going to be a lot of answers in here that I think will be beneficial. Thank you, Carl.
Thanks, Mike. Good evening. We're really excited to be here to share some of the work that is happening here in the county, because Nick is going to share different programs that are happening all around. But first, I'd like to just tell you, how does addiction affect all of us? Does it affect all of us? Well, it absolutely does. It affects us if we're parents, if we're grandparents, children, aunts, uncles, neighbors, communities, businesses. Addiction right now, it's not just the opioid epidemic. They're calling it the addiction epidemic, and it affects all of us in so many different ways. And one of the big ways is with our kids, and I think everybody's familiar with Sesame Street, right? You know Sesame Street? Do you know they have a new character? Carly. Carly's a new character whose mom is struggling with addiction. So Sesame Street over the years has introduced a lot of different characters to deal with a lot of different problems, but this problem is so big that Sesame Street has a character to help children, because over 6 million children under the age of 11 are dealing with a parent with a substance use disorder. So that's not just in the nation, that's here in our county too, and we see that. And anybody that's here from the schools will tell you that we've got schools that are dealing with these problems. And I have, in fact, a relationship with a probation officer, and she's real concerned because she's seeing so many grandparents right now raising their kids. She's even got a great-grandparent raising a grandchild. So it definitely does affect us all, and that's why this is so important. And what Francis, explained about Narcan and Mike about CLEAR, we say we're downstream right now, and we're just pulling them out. We're Narcanning people. Luckily, all of our police are involved. We are, I think, the first, as Francis said, in the state to have all of our police officers equipped, using Narcan. So we've been using that for a few years. CLEAR has been active for 3 years. And as a result, there's some other programs which I'll just tell you a little bit about, or ORP, MAT, and STAR, that are helping us downstream. We really want to be upstream, but right now we're downstream. Dr. Brudico couldn't be here tonight. He's on a cruise, but he was at the last 2 events. And Dr. Brudico, if you don't know him, he's the director of the emergency department up at Newton Medical Center. He is truly amazing. He has been at the table with us for CLEAR since the beginning, and we don't have problems with this. We have bumps in the road, and we're always working to fix them. But with the hospital, in the state of New Jersey, every single county has what we call an ORP grant, Opioid Overdose Recovery Program. And the ORP grant is, as Mike was explaining, there is coaches, recovery coaches, which started with our CLEAR coaches. This grant gave us funding to have coaches on call 24/7. And actually, I just did the math this morning, I forget, for another meeting. In the last week, our coaches were up at the hospital in the last 7 days, 26 times. That's a lot. And what the coaches do is we get a call when somebody's come in because they've used Narcan to revive them, or some other way they revive somebody, or they come in with now not just a substance use, not just a opioid use, but any kind of substance use disorder, including alcohol, which is really a big problem here in our county too, especially amongst young women. We're seeing a lot more in their 20s, young women with serious alcohol use disorders. But in the time that we've launched ORP in 2 years, we just celebrated 2 years, we've had over 1,000 calls where coaches have been called up to the emergency room within an hour, somebody coming there, or as soon as somebody's able to see them. And the coaches meet with them, and as you can see from the numbers up there, almost, all close to 90%, 9 in 10 people take the services of the coach and meet with them and talk to them. And they try to navigate them into treatment, whatever that might be for them. Maybe it's detox, maybe it's medication-assisted treatment, we'll talk about that. Maybe it's going to meetings, it's a variety of things. And of those, 40% of those people have actually been linked to treatment. So it's really doing amazing work, and I just have to say again, the hospital is amazing with the care and concern that they have around this issue. And we have great partners up there. We are really lucky to have Newton Medical Center as a partner in our community because they truly care. Another thing that the CLEAR coaches have been able to do, we have people that are incarcerated that have substance use issues, and of our coaches, most of them are trained to be able to go into the jail, and 39 people in the time that ORP has been around have actually asked for the services of a coach. We have coaches at the door when they're being released to walk them across the street to our agency, help navigate them to treatment, help them with the recovery planning and their assistance, and also with MAT, which is medication-assisted treatment, and referrals. Now most of the people in our facility are in Morris County, but we have our coaches getting approved to go to the Morris County Jail to see the Sussex County people. So that's really exciting that our coaches are so amazing that they really care about the people that they're working with, and that, again, we have such incredible collaboration in our community. Another thing that we've been doing for about a year, but really intensely since May, is we have a drop-in at our recovery center. There's a recovery center, if you didn't know it, in Andover. It's called the Center. It's got funding through the state and also some funding through the county for different services, but we have drop-in day is between 12 and 6 o'clock. People can come in, ask for help, meet with a coach. Coaches are sitting there, ready to navigate, to talk, to just listen. And as Mike said many, many times, it's the family members. In fact, the first CLEAR person, we had a family member come in first. It's the family members that many times can push their loved ones to recovery or to some services if they get help and get direction themselves. So that's why, as Mike mentioned, our family coaches, having not just people in recovery trained as our recovery coaches, but family members has been a really important aspect of what we're doing. I mentioned MAT, which is medication-assisted treatment, and we are servicing people with medication-assisted treatment here in our county. At our agency, we are able to work with Dr. Gannon, who has Genesis of Behavioral Addiction, and he is our medical consultant, and the number is actually higher than it shows up there, but since we became active with him last May 2018, we've served almost 400 people. And through the grant that we have in Integrated Recovery Innovations, and that is, we are lucky enough to get a SAMHSA grant for this work. And we're really excited that we're able to help people, because medication-assisted treatment is really a game changer with a lot of people. And there's a lot of information at our table that I hope that you'll take and learn a little bit more about it, because it's really a way that we can help people with their addiction, help get them services, help them get into treatment, and it's really saving lives. The other grant that the state has throughout New Jersey is the STAR grant, because many times what we see is people get into treatment or they're incarcerated, and when they get done with treatment or out of jail, a lot of times they will relapse. And the reason is, you wouldn't think that would happen, but there's a lot of reasons. There's a lot of triggers out there for people. So having support after you're out of treatment, after you're out being incarcerated, after all of that is really important. And the STAR grant is a grant that provides case managers and recovery coaches for a year to work with somebody, to help them make sure they're keeping in the recovery zone, to help them if they need housing, do they need to get a job, do they know how to do a resume, all the different things that are really roadblocks for a lot of people, and they don't have that support out there. So this grant just started. Actually, the other person, this is a picture a week old. We have the other recovery coach just started today, so we have a full team. running, up and running. And this is really going to be, I think, a game changer for people, is as, we've been talking, Mike and Francis, about our recovery coaches. They really are the ones that have lived experience, they know where people have been, they know what the pitfalls are, and they really can help them with different services. And there are a lot of services in our county, and I encourage you to go at the county table there's packets with lots of information that everybody should get, but there's, in the packet that we created, through funding through the state and through the county, we have different things for different parents. We have CRAFT, which is a support group for parents. That's twice a month. We have SMART meetings, all recovery meetings, 12-step meetings that happen regularly. We have the drop-in for people to come. There's Narcan trainings. We just had one last week. I think we have another one set in December. And somebody that just came to a Narcan training a month ago in September called us last week. The kit they got actually helped to save somebody's life. So that right now, remember, we're downstream is where we are, and we want to go upstream, but while we're down here, we have to use all the tools that we can and all the different things that we can put into our toolboxes, and that's one of them. Additionally, there's a clear brochure in there, and Nick has a wonderful county brochure with a lot of different services, and we have another one that's got some artwork, and this is actually from somebody in recovery. If you check it out, somebody in recovery made this wonderful artwork on the front. But if you get this brochure back there, it talks about navigating health insurance, what common terms are, what the different levels of care are, medication-assisted treatment, and shows the different treatment services. And I encourage you to make sure when you leave, we've got Capital Care back there. They're located here in Stanhope, a wonderful collaborative partner, and they offer a lot of different outpatient services, and here for people in our county. And Seabrook House, Joyce, would you just raise your hand? Joyce has been at the table for Clear for over 2 years, and an incredible partner. They've got different treatment facilities throughout the state for inpatient for people, and now offer detox services and medication-assisted treatment too, right? Yeah, yes, and they're an incredible partner. I can't tell you how many times with Clear, people don't have money. Sometimes they don't have insurance, and through partners like Seabrook and Capital Care, we've been able to get people, scholarships and help, even though they didn't have the funding for it. We've had, if you think too that you can't help, or you don't know what to do, or you feel helpless, there's so much that you can do, and I encourage you to come to a meeting. We have different meetings once a month for recovery advocates, but we have a closet in the back that's got toiletries and pajamas and sweatpants, because sometimes when people come to the hospital, they've overdosed and they're soaking wet. Why? Because their friends throw them in the shower or in the tub, thinking that's going to sober them up, and it doesn't. They end up in the hospital and they're going somewhere to treatment. Maybe Seabrook House is coming to pick them up, and it takes a few hours to get there. They don't have any clothes. They literally have a plastic ShopRite bag with the few belongings that they have, because sometimes, we see a lot of people that are homeless, they're couch surfing, they don't have a place to go. And so our little closet in the back is, people have donated things to us. We have toiletries, and one night I got a phone call. It was a Friday night. I had come home from somewhere, and I put my pajamas on, and I got a phone call from one of the coaches up at the hospital. She said, this guy, we're waiting, he has nothing. Does your husband or your son, do you have any sweatpants? So I went around the house and got all the clean sweatpants and sweatshirts I could, put it in a bag, went to our office and got the toiletry bag and took it up there and gave it to him, because he had nothing else, and he was so, so grateful. So we can use nice clothing and things like that for people, sweatpants, pajamas, for people to utilize. There's just a lot of different ways that you can get involved with Clear. Mike showed that slide of community engagement. Well, the things that we offer, there's not grant funding for everything, so we really do need the community to get involved. We had the one brochure here that I'll just show it to you because I think it's really exciting. This was designed by a kid up at SCCC in a graphic art class. Mike went up there with one of our recovery coaches for a few weeks just to work with the kids so they could understand what Clear is, and he designed this. It's beautiful. I mean, it just shows you we've got kids up there, ready to go out into the workforce that can do incredible work. So that's another way that people can get involved if you're a graphic artist or you have connections. So I just encourage people to really think about ways they can get involved with this, because if it's not your family, you're lucky. But it's your neighbors, it's your relatives, You know, it's all the people in our community. And up there is a picture that I carry and laminated. I have this laminated in my date timer because when I'm out talking about CLEAR, there's no better way for me to show what the magic of CLEAR is than the pictures of our recovery coaches. And these are people in long-term recovery that are doing great work here in our community. It's you and me, it's our neighbors, it's our aunts, our uncles, our friends, and they're so grateful to be doing the work that we're doing. They're so committed to their work and to helping people, and it's one person at a time. So again, I encourage you to come, find out when a recovery advocacy meeting is. You do not have to be in recovery, but be a friend of recovery. You can be an ally of recovery. So to close with, for my piece, that face up there, that's a face of recovery. That is a young woman, Taylor. She's been in recovery since May 2017. She walked into the Newton Police Department, asked for help, went into treatment. She's doing great. She's got a job. She's got a car. She's contributing to our community. She's giving back, but that's the face of recovery. So many times we see the negative things, as Francis and Mike spoke about, the negative pieces of addiction. We see when people are at their worst and doing things that they never thought that they would do, selling their grandmother's jewelry, which they never thought that they would ever do something like that. And parents can't imagine how their kids could get to that point. But it happens. Addiction is really, it's a disease, and it's something that we really need to address. But this is what we have to remember. This is what when I see people every day at our recovery center and people that I work with, I see the young faces and the older faces, all different ages of faces of people in recovery that are back again. They're working, they're contributing, they're volunteering. That's what I want you to think of when you think of CLEAR. Is CLEAR, there's a lot of hope around CLEAR, and recovery does happen, and it really it is real. So I want you to remember that. If you get this little handout, like I mentioned to you, you can see some of the numbers up there. We've got another Narcan training coming up on December 11th. We've got craft meetings. If you know a family member or a friend or somebody that's got addiction, somebody with addiction in their life, tell them to come to a craft meeting the first or third Thursday at 6:30. It will help them. I guarantee you it will help them. We have support groups happening all during the week, and the drop-ins happening on Monday. So I encourage you to get these numbers, keep this card and the county handout, keep it somewhere handy in your phone book or on your counter. Well, we don't have phone books anymore, but on your counter somewhere that you see it often, so you know if somebody needs help. And now I'd like to turn it back to Francis to talk about Operation Helping Hand. And I just want you to, he doesn't know this because Katie, we just did Operation Helping Hand up in Vernon on Saturday with 3 different coaches and 3 different police officers. And one of the police officers told Katie that it was the most meaningful work he's done in his career as a police officer, really making a difference. So Francis is going to tell you a little bit more about this exciting program.
Thank you.
Yes. What? Which one?
I'm going to come back to this in just a little bit. Thank you, Becky. Yeah, it's amazing, isn't it? You think about what this started with. It was an idea to try to help people that you gave Narcan to give them a pamphlet. That pamphlet grew into CLEAR, which grew into ORP, which grew into STAR, which grew into the hospital, it grew into law enforcement and the community all coming together. It's become a living and breathing way to save lives and help our community. And it started with an idea. It started with a few people coming together and then getting others involved. And as Becky said, that's what we want to do. We want to go upstream. You're a part of our upstream, going up, trying to find a solution, prevention, trying to help. And what else did this program lead us to? It led us to a program called Operation Helping Hand. And it's pretty exactly what it is. Giving out a hand to help someone with a substance use disorder. Started in Bergen County, and in Bergen County we did a 4-county operation. It was Morris, Sussex, Passaic, and Bergen County. And under the Bergen model of Helping Hand, you really have to have an open market, open air market, where a lot of drug transactions happen. And what we were doing is, after transactions happened and people were in possessions of small amounts of heroin or some other drug that they were buying, they were arrested. But after being arrested, they were immediately brought back to a central station where they were introduced to a recovery coach to give information about recovery. And it wasn't in lieu of their charges, but it was a way for them to find help. Now, the one thing Sussex County does not have, thank God, is an open air market. As Chief Richard said, most of our drugs come from Patterson and Newark. And today's day and age, almost all of them come from Patterson, I think, or most of them. But, so we don't have that type of issue in Sussex County where you have big, 1,000 people coming in to buy drugs all the time in the same area. So Operation Helping Hand was offered as a statewide grant that each county prosecutor's office could apply for. First year, 17 counties applied. Sussex County was one of them. And our idea was, instead of having an open air market, let's pair plainclothes police officers with recovery coaches. And we're going to go door to door. Police officers are going to come up with lists of individuals who we thought were at high risk of having an overdose or potentially having a substance use disorder. People that had had 3 or 4, maybe 5 shoplifting charges in the past, or maybe some other theft, or maybe they had been Narcaned a year or 2 earlier. We came up with a list of those people that police officers knew. They did not go out in uniform, they went out in plain clothes, but they're somewhat for protection with regard to the recovery coaches, knocked on the doors and said, hey, this is a recovery coach. Someone who has been through the hell that you either have been through, may be going through, or may know someone else that needs help. And here's our information. And that's how that program started, Operation Helping Hand. Law enforcement officers. I mean, as Becky said, I started in 1998 as an assistant prosecutor, but in 2014, when we first brought Narcan to the county, it was still an issue. Law enforcement's job was to arrest people using drugs. That's what was beat into our minds. But that evolved. It evolved that duty to serve your fellow man and to protect. And that's what started with this. So now we had them going door to door. Still, even after having Narcan for a few years, having the other success of the programs, there was still a little bit of that, I'm not so sure this is the right thing to do. Well, they knocked on some doors, and they saw the effect it was having. And as Becky said, these officers to a man will tell you it is the most important work, or some of the most important work they have ever done. There's one particular case I like to talk about. It happened in Andover, where we were going to an address where we had someone that we thought may need our help. Well, that person actually wasn't there. It was at a hotel. But we knocked on doors, and we were putting pieces of paper under each door just to leave the information. And there was a young lady who was inside one of those rooms. She went to that room the night before to get away from her substance use disorder, talked to her mother, and told her, said, basically, Mom, I'm either dying here or somehow I'm going to get help. That next day, a police officer and recovery coach answered her prayers, knocked on that door, and gave her help. That's the success of Operation Helping Hand. We are now going to municipal courts because we know this problem doesn't just start with a person using heroin or fentanyl. It starts with them starting with an Oxycontin, and then when they can't get those drugs, they start stealing, and maybe it is shoplifting. And we see that happening. So there's low-level little crimes going on in their path of their substance use disorder. So if we can get to them upstream, get them before they become further along into the criminal justice system, we can help save them. By giving this information to you, you are now part of our team moving upstream. You are part of the solution, part of this clear community that is going to try to rid Sussex County of its opioid epidemic. I left this slide up because, you know, recovery is a solution that benefits everyone. Chief Richards talked about it. If you take a look at the police blotter, take a look at all your thefts, home burglaries, shopliftings, know that probably 90% of them have to do with someone who has a substance use disorder. And if we can stop that and help solve their issue and get them on the road to recovery, it helps not only them, their family, but it helps each and every one of us. I think they also mentioned earlier about the stigma-free zone, and that's where we've been going, that there should not be a stigma behind recovery. And I mentioned this last time at our last meeting. It's time to stop saying that we're just a stigma-free zone. That was the first step. We had to start that in 2014 to get to where we are today. But taking a look at that picture, those pictures, look at every single person. There's a smile on a face. A smile on a face because they're in celebration. They're in celebration of recovery. And that's what each and every one of you has to be willing to do. Celebrate others' recovery. Do not make them feel ashamed and that they need to coil back about what they're doing. They have been on a road through hell that hopefully most of us never have to go through. But now they're on recovery and they're giving back to a community. Let's make Sussex County be a place where recovery is celebrated and proudly worn on your sleeves. Thank you very much.
One thing we've heard tonight is that it takes a full community to help. And included in our community, we are very fortunate to have Valerie Melke here with us this evening, who is the Assistant Commissioner of the New Jersey Division of Mental Health and Addiction Services in the Department of Human Services. She is responsible for coordination, administration, management, and supervision of the community public mental health system, and for regulating, monitoring, planning, and finding substance abuse prevention, treatment, and recovery support services. And I think most importantly to all of us, she calls Sussex County her home, and she has lived in Sussex County in Hopatcong most of her life. Valerie, thank you for being here.
That's okay. Well, good evening. Good evening. So thank you very much for the introduction. And as was stated, I am a Sussex County resident. My parents moved here in 1967. They still live in the home that I grew up in. I'm now living about a mile from them. And my kids grew up here in Sussex County. So Sussex County certainly is very near and dear to my heart. But I'm really pleased and really honored to be able to stand here before you to talk about really this critical epidemic that is really not only hitting us across the nation, but it does touch down here in Hopatcong as well. So I thought I'd share some statistics with you and tell you a little bit about addiction and some of the things that we are doing here, specifically in Sussex County. So in 2018, here in Sussex County, there were 1,358 admissions, which accounts for about 884 individuals to addictions treatment in that year. That heroin and other opioids was the primary drug for admission in about 49% of the people who were admitted here from Sussex County for treatment. That intravenous drug admissions accounted for 42% of those admissions. That most individuals were admitted to outpatient or intensive outpatient treatment. That's about 55%. That short-term residential admissions were 14%, and long-term residential accounted for 6% of the admissions. And what's important about that, and the reason why I wanted to highlight that, is that seeking treatment doesn't necessarily mean that you have to fully upset your life and have to be concerned about leaving family and home and work. That you can embark on the road to recovery while continuing with your home obligations as well. And that's real important because some individuals feel like they have to leave families, leave their homes to seek treatment, and you can seek treatment concurrently while you're at home. That most individuals refer themselves, about 31%, to treatment, whereas 35% of individuals will actually refer through the criminal justice system. And about 54% of the individuals that were treated here in Sussex County had Medicaid for their insurer, and 30% didn't have any insurance at all. So a couple of points I want to hit home. One is that addiction does not discriminate. It doesn't discriminate by age, by race. It doesn't discriminate by socioeconomic status. It doesn't matter your title. It doesn't matter what your religious beliefs are. If you ascribe to religious beliefs, it just doesn't discriminate. It affects everyone. And to address this disease of addiction, that it takes a multi-pronged approach, and much of which you've heard today. So part of it is prevention, and that's what Becky spoke of in terms of that upstream approach, that we want to prevent individuals from embarking on this the disease of addiction. That secondarily, individuals who are impacted by this disease, that treatment is available for individuals to receive and then to embark on their road to recovery. And then the next prong is the recovery supports. That treatment, though effective, often individuals to continue on their road to recovery need individuals who are there to support them, to guide them, to provide them with encouragement and with hope. So those recovery supports are important as well. So we talked a lot about addiction. I just wanted to provide to you a definition here of addiction that's issued by it's a modified definition by the American Society of Addiction Medicine. So addiction is a chronic brain disease in which a person regularly finds and uses drugs or regularly does something, such as gambling, despite the negative things that can happen. It is a brain disease because addiction can change how the brain works. Besides harming a person's health, it can change how someone thinks and feels. This may last a long time, lead to other harmful actions, and cause difficult relationships with family and friends. Without treatment and recovery, addiction may keep getting worse. So it's important to really understand that addiction is a disease. And it's a disease that with treatment can be overcome. So I wanted to share with you a couple of things. First thing I want to share with you, and I'm going to close with this as well, is that if you know someone who is impacted by the disease of addiction, that they can call free 1-844-REACH-NJ, or that telephone number is 844-732-2465. They can call 24 hours a day, 7 days a week, holidays and weekends included. And when that person calls, if it's a person who themselves are seeking treatment, the person on the other end of the phone, who's a clinician, who will answer the phone, the person doesn't have to go through a menu, push 1 for this, push 2 for that. It's answered live within usually 20 seconds of the person calling. That there's a clinician on the other end who's going to ask them a few questions. And the reason for those questions is to get a sense of, one, if they have insurance or not. Secondarily, based on what they are experiencing, to direct them to what would be the most appropriate level of care. So sometimes it's detox. Sometimes it may be the residential services that I spoke of. Sometimes it may be outpatient services. And then the individual on the phone, if it's during business hours and the place of business that they're referring to is open, they will actually stay with the person and what we call do a warm handoff and say, here, hold on a moment, I'm going to connect you to the organization that I think can best serve you. They'll get that other organization on the phone. Once the individual in that organization have connected, the call line will hang up, and then that person can work with the organization to connect to services. So through this line, individuals, when they call up, if you don't have insurance, we'll connect you to treatment. That treatment can be paid for with state dollars. We also have some federal dollars that support that. If you call up and you have Medicaid, we'll connect you to a provider that accepts Medicaid. Again, there isn't any money out of your pocket to receive treatment. If the person has private insurance, they will work with the individual to look at the back of their insurance card to identify how to connect with a provider who accepts their insurance. And they will, again, if it's during business hours, they will connect that person to their insurance carrier to help them to best connect to services that are covered by their insurance carrier. So again, that's 1-844-REACH-NJ, and they will help to connect individuals. But let's say you're a family member and you're concerned about your brother, your sister, your spouse, your mother, your father, your cousin, and want to get them into treatment. Now, at REACH-NJ, they're not going to be able to connect the person to treatment without that person on the line. But what they will do is connect to the individual to what we call NJ Connect, and NJ Connect for Recovery. Their telephone number is 855-652-3737. And what I will do is I have a stack of handouts that will include this, which is the NJ Connect for Recovery. Handouts that will include this addiction help and the telephone number, and the booklets that I read from in terms of what the definition of addiction. And through NJ Connect for Recovery, they will work with families to help them to understand what their loved one is suffering with in terms of this disease of addiction. They will help them to understand how they can best support their loved one and to try to encourage them to seek treatment. They provide some educational services out in the community to help family members as well. So I just wanted so Becky really shared a lot of the services that are available here in Sussex County. And I just wanted to share and highlight a few other services that are here and that are available. All of these services that I'm going to tell you about, they're all free of charge. And again, they're going to be on this handout, and I'll leave the papers in the back. They have the telephone numbers of the organization that operates those services, and how to connect, and a description of the service. So again, this is not even an all-exhaustive list, but these are services that we are funding directly, and so either through Medicaid or through our state funds, people can access these services directly. So one of the initiatives that I wanted to talk about is our public education that's made available for older adults. And so what we find is in managing pain, often older adults may have prescriptions for opioids that at times, the pain that they're experiencing could be probably better managed without the use of opioids. But in the event that they need opioids, they'll also talk about how to safely store those opioids so that other family members or friends or whomever who may come to visit don't access those medications. We have an initiative called our Opioid Overdose Prevention Program. Again, this is a free service, and it's through the Morris County Prevention is Key. So they're responsible for the northern part of the state, where they're going out and they're providing free training to individuals who are interested in learning about opioid overdose, and learning about the signs and symptoms of an overdose, and learning about how to support and revive an individual who is in the midst of an active overdose. And at the conclusion of that free training, individuals will actually receive a free naloxone kit to take with them. So in the unfortunate event that they are that they experience someone who is experiencing an overdose, they're able to use that free naloxone kit to save their life. We also have an initiative where we're working with teens. So we know and recognize that there are times that young adults, kids in high school age and sometimes even younger, they're involved with sports, they experience a sports injury. And that at times opioids are prescribed. What this program does is it begins to take a look at some of the clustering of opioid prescriptions. And if it pops up where it's identified that there may be an over prescribing of opioids, that a team will go into that community and provide some information and education around alternatives to managing pain, provide information to coaches around alternatives to managing pain, and to try to really stem the opportunity for individuals to develop an opioid overdose. We also have another program where we're kicking it off actually in November. Newton Memorial Hospital, Newton Medical Center is one of the hospitals that applied and was selected to participate in that. And that is to look at alternatives to prescribing opioids to manage acute pain. So there are individuals where opioids are absolutely necessary and the appropriate medication to manage pain. But there are also many other alternatives to managing pain other than opioids when appropriate. And so what we're going to be doing is working with the hospitals to help them to increase their capacity to serve individuals to effectively manage their pain without having to prescribe opioids. And the one last thing that I just wanted to talk about is medication-assisted treatment. So Becky talked about that a little bit. And I wanted to talk about it because it's real important. It can be really key to helping to support individuals who have an addiction to an opioid. So you may have heard of methadone and the use of methadone as a medication to treat opioids. There's buprenorphine, naloxone, Vivitrol. These are all medications to treat an opioid addiction. So as I mentioned earlier, addiction is a brain disease. It's a brain disease. It's not a moral failing. It's a brain disease. And for many individuals, the best way to help to support them in treating that brain disease, the best way to support individuals to help their brains heal from this brain disease is medicine. Methadone, Vivitrol, buprenorphine, naloxone, many other forms of the medications that I mentioned are all medications that help to address this brain disease and to help heal brains. So the reason why I say that is because more often than not, unfortunately, there's such a negative stigma around the use of medicine to treat this brain disease. More often than not, you hear people talking about it's just substituting one drug or another. More often than not, it's unfortunate that you hear people talk about just be strong and just say no and just stop using drugs and you'll be fine. But I'm here to tell you that it's a disease, and this disease with medication can really help us not only save lives, but move individuals onto the road to recovery. So all of the programs and services that I've spoken of, it's really all about providing hope to individuals who at times are feeling hopeless. It's all about saving lives, like the naloxone, right then and there, just saving a life. And it's all about restoring lives. And as we saw in the picture above, before that Becky showed, that it's about restoring lives of individuals with their families, enabling individuals to return back to work, to return to school, to being productive citizens, And so, to close, I just really want to encourage you, as you leave here, is to take handouts, as many as you want. I have these booklets here. These booklets not only talk about what addiction is, they talk about the medications that are used to treat addiction, they talk about treatment options to treat addiction and the like. It's a very short read, quick read, but it's a great resource. It also has on the back the telephone numbers that I spoke of in terms of Reach NJ and NJ Connect for Recovery. I'll also leave a stack of this document here, and these are all Sussex County specific programs. Again, it's not an exhaustive list, but it's a list of services that we fund that are all free, that individuals can use to access, to find out more, to get more information. And then I will also leave for you this flyer here, this Reach NJ flyer, so that, and please, I encourage you to take them to your places of worship. Take them to your civic centers. Take them, share them with families, share them with neighbors, share them with friends. Take them to work, because undoubtedly someone who is suffering, or someone who knows someone who's suffering from this disease, that this message can provide a message of hope and a pathway to seek that recovery. So thank you very much for your time, and thanks for having me today.
You know, it does, as I said, it does, and we've talked about it, it takes a whole community. And I just want to take a moment to thank some of our community for being here this evening, for these wonderful speakers who've taken time to be here, to our service providers. If you have not been back to the tables, I would say go back to the tables, see what we have for services. And in particular, we have hidden in plain sight over to the right, to my right, to your left. If you have not been there, you have to go see that demonstration, because it is amazing where drugs and drug paraphernalia can be hid. So I would suggest that you do that. Our next speaker is Nick Louisi. He is the county's drug and alcohol coordinator. In addition to that, he also is the coordinator for all of the county alliances. He has been an advocate and been in trying to save folks, in prevention of drugs, in just taking a look at substance use disorders and trying to help in every way, in any way possible. He's also on the LEAD board, which is Law Enforcement Against Drugs, and he's an amazing, amazing person. We're happy that we have him. I'm going to introduce him, but before he gets up, he's going to begin with a video. And some people may find this video to be offensive, and please know, we're not playing the video because it is offensive or intended to be offensive, but rather it's meant to convey the serious nature of this topic and to raise a level of awareness that helps to end the senseless loss of precious lives. So I thank you and I introduce Nick Louisi.
Thank you very much. And before I get started, I want to thank Deputy Freeholder Director Patillo and Carol Novert for giving us the opportunity to put together this program for you and to bring you the information that we think is important for everyone to know as far as the opioid epidemic and what is available in Sussex County, what can be done in Sussex County, and how people can get help. But let me show the video first, and then we'll get into my presentation. Again, this video might be disturbing for some people. It's not very graphic as far as violence or blood and guts or anything like that, but the subject matter can be graphic for those who might be sensitive to it.
Hello, what do you need, please? Fire medical?
I have 3 people that are, apparently they seem to be passed out drunk, not waking up in my parking lot. Like 2 of them are on the ground.
11:30 on a Saturday night. Deputies are called to help 2 men and a woman, all unresponsive.
Well, when I pulled into the gas station, it's very well lit. You could tell right away that there was something different about this one.
Yo, bro, wake up! You're snapping at them, you're screaming, you're shaking stuff around, moving things, and they're not doing anything.
In the back of your mind, you're like, well, what is this? What else is going on?
At this gas station on Red Bug Lake Road,
Hey!
the normal measures deputies take to wake people up aren't working.
Now at this time, we're realizing we have probably an overdose, a triple overdose at that.
And I've never responded to one where there's 3 people and they're laid out, completely unresponsive, turning blue, the colors leaving their faces. It's scary. Got 3 non-state deployments.
Since November 2016, each SCSO deputy has carried with them Narcan, a powerful opioid inhibitor sprayed up the nostril that has brought dozens of people who are overdosing back from the brink of dying.
Typically, when we administer the Narcan, you get that deep breath. You see the results right away, but that didn't happen this time. All 3 of them had 1 dose of Narcan originally. Still wasn't enough. They needed more treatment.
Come on, bud. Come on, there you go. Wake up, wake up.
Seminole County fire personnel arrived with more Narcan. Each person ended up needing multiple doses.
You see anything else in the car, RT?
And now the deputies have custody of this pickup. They have to determine what caused all this.
After these subjects were transported to the hospital, we're still left with the vehicle, and that possibly hazardous material that's inside. We don't know what it is or where it is.
I was nervous, I will say that.
To protect her from coming into contact with this dangerous substance, Deputy Caitlin Henry put on protective gloves and a gas mask.
There were 2 people standing by that could take care of me if something were to happen.
And finally, Henry discovers this small baggie. She later asked the female who overdosed what it was.
Then I said, can you be candid with me? What did you think you were taking? And her reply was, oh, I thought I was doing cocaine. And she was like, but that's not cocaine.
In reality, the drugs the trio were taking here that night were laced with fentanyl, a synthetic opioid that drug dealers use to make their drug supply last longer and more profitable. But it also makes the drugs far more deadly.
Sometimes the drug users, don't even know that their drugs have been mixed with this. And this is leading to fatal overdoses at record numbers.
Fentanyl and heroin combined contributed to 82 fatal opioid overdoses in 2018, more than homicides and fatal crashes combined.
And as Sheriff of Seminole County, this is my top public safety concern. If it was not for the use of Narcan, our death numbers would be higher than what they are now. At the end of the day, they're still someone's daughter, son, brother, sister, something like that. So, we're going to do everything we can do to help them and let them see another day.
that video was obviously not from New Jersey. Rather, it was an incident that occurred in Florida, and those were the police body cameras that were showing what it was the officers were attempting to do. That's not to say that that doesn't happen here. In fact, it does. We've had similar situations in Sussex County where the police have responded to multiple overdoses. It is occurring here, and the whole purpose behind this evening and this event is to bring the awareness up to the people of the county, what we're doing in the county, how we're reacting to this epidemic, what services are available, and what everybody can do to answer these three questions. And that's what I'm going to try to do a little bit for you tonight. Where does it start? It starts with the emergency response. Our first responders, you've heard about the Narcan that are distributed to the police departments, and the police departments are carrying Narcan in the vehicles. And the officers are trained in its use and how to use it and when to deploy it. Our first aid squads, who we had a representative of the EMS here tonight to speak to people earlier. They also carry the Narcan kits in the ambulances. Our paramedics obviously have them. So it starts with the first responders when there's an overdose situation. They'll get to the scene, they'll administer the Narcan, and they'll get that person to the emergency room. From there, it goes into the emergency room, and Dr. Brutico, since becoming the emergency department director at Newton Medical Center, has really stepped up the efforts in the emergency room to address the epidemic as best they can there. The staff is very receptive to the different agencies and the different groups that have made themselves available for somebody who's gone through an overdose situation. The ORP program has been tremendous, working with Newton Medical Center, and the Center for Prevention has really done a fantastic job getting recovery coaches trained to try to address the situation in the hospital. You heard the stats. In 2018, in Sussex County, there were 127 Narcan administrations from police and EMS. That doesn't account for Narcan administrations by family members, since now Narcan can be purchased by family members, and family members are getting trained in Narcan administration. So there was 127 administrations by EMS and law enforcement. And in 2018, there were 35 overdose deaths. And we've held pretty steady around that number for the last few years. And we're hoping very soon that number will even be reduced further. What happens when someone goes through an overdose situation and agrees that they want to get help, but they don't know how? I don't know how many phone calls I get in my office from people who just don't know where to turn when they have a situation where they want to get treatment, or they have a family member who needs treatment. These are just a few of the treatment providers in our area, and I've heard other people at other times say to me, there's just no service here for somebody with a situation regarding substance use disorder. And I have to say to them, no, there is. You just don't know about it, and that's why we're here tonight. So these are just some of the providers. Of course, at the top is Atlantic Health and Newton Medical Center. Capital Care, who's represented here tonight, as well as one of our providers for outpatient and intensive outpatient treatment and more. You could speak to them to get more information about that. Caring Partners of Morrison, Sussex County, the Center for Evaluation and Counseling, the Center for Prevention and Counseling, Freedom House, Garden State Treatment Center is a new treatment center that opened up in Sparta about 2 years ago now. They just started operations very recently. High Focus Centers is another center in the area. The Pocono Mountain Recovery Center right over in Pennsylvania. Sunrise House right in Lafayette. Turning Point is our provider for detox and inpatient treatment services for people who don't have insurance. And there's many more. And you'll see it back in the table when you go around. There's a brochure that we've put together that has a list of many of these providers and their contact information. So if you have a family member or a loved one or a friend who needs to get treatment or doesn't know how to get treatment, you can take this home and you can show this to them. It's also on our website. Ms. Milkey from the Division of Mental Health and Addiction Services already went over this, but it bears repeating. The 2018 numbers for substance abuse treatment in Sussex County, 47.6% of the total admissions were for heroin and other opiates, almost half. 40.9% of those were IV drug users, people who use needles. 14.6% required medically assisted treatment, and 77.8% have received treatment previously. Some of the levels of care in treatment services include outpatient treatment and intensive outpatient treatment. They're pretty much what their titles describe. I'm not going to go into the whole definition because you don't want to hear me read it to you, but it's there. It's in some of the information that's in the back as well. Capital Care and the Center for Prevention and Counseling have contracted with the Sussex County Department of Health and Human Services to provide those services to residents who don't have insurance and can't afford to pay for those treatment services. So if you don't have insurance or you don't have coverage in your insurance and you need to get this type of service, it can be provided for you at no cost through our department. Detox services and short-term residential services, we contract with Turning Point Incorporated in Patterson. And a lot of the reaction I get from people when I tell them about Turning Point is, oh God, I don't want to go to Patterson. I've been to Turning Point's facility in Patterson. It's at the old, if you know anything about Patterson, it's at the old Barnet Hospital. And it's not the worst section of Patterson. Getting in and out is relatively easy. And it's a lockdown facility. That means that when you're a patient there, you're not permitted off the premises unless you're in a group and you're with an escort. So even though it's in Patterson, it's not as bad as some people might imagine. Yes, I'd love to have a provider up here for our residents. Unfortunately, we don't. We try to give the best we can. And I've been to their facility and I've seen the way their system is set up. It's really a very good system there. They have a good, tremendous staff and a good success rate with their clients. Halfway house services, those are for people who are transitioning from, say, an inpatient residential facility, getting back into the world, and they're just not quite ready yet, so they put them into a halfway house. And we contract with Freedom House for men and Turning Point for women to do our halfway house services for us. And then you've heard a lot about recovery support systems, and really, if you want to get, or if a person wants to get off of, or get away from their substance use disorder, I can't recommend getting into a recovery support system strongly enough. This is where the long-term phase of your recovery begins. This is where you need to be if you have a substance use disorder to not have to go back into a treatment system or back into for treatment. This is where your supports are. This is where your help is going to carry you for the rest of your life. And we have some tremendous providers that we contract with for recovery support systems. I'm not going to get into details. Becky's already done that, but a lot of it is with the Center for Prevention and Counseling. DAISY has the DECIDE program for adult male offenders who have substance use disorder. And the one thing about the DAISY DECIDE program that I like to share with people, they contract with us for this particular program. It's a very specific program. But the one thing that is most impressive to me about their program is that they have a 95% success rate. And when their clients graduate from the program or are certified as completing the program, many of them return as volunteers just to be there, to continue with the group. So that's how tremendous that program is. And you've heard a lot about the CLEAR program, another one of our great recovery support programs. And there are more even listed in this brochure that's at the back of the table. There's a tremendous amount of recovery support systems in the county. And that's really the biggest step, not the biggest step, one of the most important steps in staying in recovery is to getting into one of those service programs. Now, we were all talking about how we react to the opioid epidemic, but one of the things that we've kind of not gotten into in depth is prevention. And my career started in 1989 when I became one of the first DARE officers trained in the state of New Jersey. I've been doing prevention work since a few years before that, but very much involved since then with the DARE program as a police officer, as a municipal alliance coordinator in my hometown. And then after I retired from my police department job, I was fortunate enough to get picked up here by Sussex County and become their prevention person in Sussex County before I transitioned into the Office of Substance Abuse and Alcohol Services as well. And I always said this throughout my career, that without prevention, all of the money that we have for treatment, we would need probably 1,000 times more. Our need for treatment is big now, it's tremendous. Our need for treatment services, it's almost impossible to cover it all. But if we didn't have prevention, there would be so much more need for treatment. And I wanted to talk about some of the prevention programs we do have in the county. The first I'll talk about is the Coalition for Healthy and Safe Communities. And the coalition coordinator is Ashley. Raise your hand, Ashley. Say hi to Ashley. Ashley is the coordinator here in Sussex County. She does a tremendous job. And tonight, before you leave, if you haven't checked out the Hidden in Plain Sight display in the corner, make sure you do and talk to Ashley and talk to Tina about it. It's a tremendous eye-opener for anybody who may have teenagers, may have young people living in their home, and you can see some of the tricks that they try to pull. And that's a good eye-opener for you. But the coalition does a lot more than that. They do a lot in the community, and it's a grassroots community-based group. And they're always looking for volunteers. If you want to get involved in prevention, you can look at the Coalition for Healthy and Safe Communities and get some information from them. The Vernon Coalition up in Vernon is similar to the Coalition for Healthy and Safe Communities. They were begun a few years ago with a Department of Children and Families grant from the federal government. Is that right? DCF grant? DFC grant? And they've been around for a few years now, using federal dollars to bring prevention messaging to the people of Vernon. Forward Franklin is a relatively new prevention group in Franklin to address the specific issues that are going on in Franklin. And again, a grassroots community-run group aimed at addressing the issues in their community. And finally, we have the municipal alliances. The municipal alliances, we have 11 municipal alliances in Sussex County representing 22 of the 24 towns. Right here in the Lenape Valley area, we have the Lenape Valley Municipal Alliance, which is covered by the townships of Stanhope and Byram. Volunteer-based, community-based, always looking for people to join them, always looking for people to help them. It's the Municipal Alliance program is a program that receives grant money that gives funds to communities to put together prevention plans in their communities to address specific needs that the communities may have. We're actually in the process of doing a new grant cycle, so we'll be putting out new programs. If you look at all of these prevention groups and all of these prevention plans, there are over 100 prevention programs that are taking place in the county from the cradle to the grave, starting in preschool, starting in the grammar schools, through high school, all the way up to senior programs. We try to reach out to as many people as we can, because if we didn't do prevention work, we'd need a lot more treatment, and I firmly believe that. And then here we have the Recovery and Family Support Services. Once again, the center has a tremendous group of recovery supports and family support services. They're listed up there on the board there. But we also have the New Jersey Connect for Recovery phone number, the 844 Reach NJ phone number, and you've heard all about CLEAR. I talked about DAISY, but the other thing I didn't talk about was NAMI, the National Alliance on Mental Illness, which is another program in the county that doesn't just address mental illness, but also addresses substance use disorders for people in the county. And these are your supports. These are the groups that we're going to help someone either with substance use disorder or a family member of someone with a substance use disorder to try to get them better, to try to get them help, and to try to keep them from succumbing to their disease. If you'd like more information, or if you'd like to find out how you can help, this is our phone number at our office, and that is my extension. It's also the email address. And I answer every phone call and email I get, so don't be afraid to call. Thank you all again for being here tonight, and before I finish, I also want to let you know about one other thing that we're going to be bringing up to Sussex County, and that is something that is relatively new. It began in Maryland a few years back. As soon as I find the slide, I'll show it to you. There it is. It's called the Overdose Fatality Review Program, and what it is, it's a collaborative effort between the Department of Health and Human Services, the United States Drug Enforcement Administration, and the New York, New Jersey High Intensity Drug Trafficking Area Group of Law Enforcement. The purpose of the program is to review overdose fatalities for Sussex County residents and to try to find where the gaps in the system are and try to address those gaps. It's not meant to point a finger of blame at anyone. It's just to look at what happened, why that person had a fatal overdose, and what can be done to prevent it from happening to someone else. We have the cooperation and the commitments of the County Prosecutor's Office, the County Medical Examiner's Office, the Board of Chosen Freeholders, and pretty much all the groups that are here tonight have agreed to participate in the program. Confidentiality is key, so everybody will be required to sign confidentiality agreements. HIPAA laws are always concerned that we make sure that we follow the HIPAA laws. And we're going to be rolling this program out in the beginning of next year to try to find gaps, if there are any, to prevent more fatal overdoses. And that's all I have for tonight. I can open it up to any questions, if anybody has any questions for any of the presentations that we may have.
Just give us your phone number again.
Sure. The office is 973-940-5200, and the extension for my office is 1383.
Thank you.
You're welcome. Any other questions? All right. Well, I want to thank you all for coming tonight. Appreciate it. Make sure you check out that Hidden in Plain Sight display. It's a pretty awesome display. You'll learn a lot from there. And please stop by and grab some information from our providers as well. Thank you again, everyone. Oh, sorry.
Yeah, can I just make a comment to this group?
Sure.
Just very briefly, just to augment what was said about myself. I'm from Jersey City. My wife's from Hoboken. We found a beautiful home in Bergen County, and my sister-in-law lives in Tobyhanna, which is by Mount Pocono in Pennsylvania. And driving to her house, we discovered Sussex County, which is like God's gift to the state, not to the country. We fell in love with it. We bought a little cabin in Sussex County. We were in Bergen County for 34 years. We're planning to make this our home. I've been practicing addiction medicine for 26 years. And I just want to open, first of all, I really appreciate you having this here. And I will say that Morris and Sussex County have been on the leading edge to treatment. And I think the key here is education. We're going to approach 100,000 deaths, as was mentioned by the Attorney General. That's almost double what we lost in 13 years in Vietnam. But remember, you fellas have lakes over here, and when you throw a pebble in the lake, you see that radiated. So when you have one person in the family that has this disease, it affects everyone. It affects the community, it affects their children. If they're children, it affects their parents. So it just goes on and on. I think one of the keys is education. And I'll leave you with 2 words. I call addiction the equal opportunity destroyer. As this lady pointed out, it affects all of us. And the 2 words I'd like to leave you with, to be very brief, is stigmata. And the thing is, I deal with people, and you have no idea when they come to me and say, I'm the bad seed. I wrote some notes down, this is what I was thinking of. And I'm the bad seed in the family. I'm the black sheep. Everybody else is okay. I tell them, no, you have a disease that your other family members may not have. As was pointed out, the #1 drug pusher in this country is a U.S. physician. Not only do 80% of people start on a prescription, but 50% are pre-programmed genetically. So that's why when you went to college and you were drinking at night or in high school and you survived it and now you're a normal, productive individual and your buddy did not make it, that is also a reason for it. So the thing is, we have to end the stigma. This is basically a disease. Jokingly, I was trained in internal medicine. The American board is going to kill me for saying this, but I jokingly say, I don't know if diabetes is a disease. And I think the jury is out on cancer. But addiction, now that there is a disease. And the second thing is we need treatment. And you know, as I go riding the community here on Route 206 and Route 80 and Route 15, I see ambulances passing me by, and they're going to Morristown Memorial Hospital or they're going to Newton Hospital. Somebody had a car accident. Some poor gentleman is having a heart attack. Well, I'll tell you, they get care right there. And of course, I heard a lot of great things here, but I will tell you how many people do not get care. Do not get care. People think it's fun to do drugs. That is the perception that you have. It is not fun. These people are so distraught that many of them have committed suicide. Not overdose, committed suicide. I'll just give you one. Sarah tried to kill herself 4 times. She was so depressed with this disease, she couldn't get this monkey off her back. 7 years ago, I'll leave you with this one. It is heartbreaking. I had a young woman, 30 years old, name was Kelly. She had 3 young children. She was a single mother. And I knocked on so many doors, and I know people. And this is only 7 years ago, this Christmas. I made phone call after phone call. Finally, no one would give her a bed. Finally, I gave her a call. She just sounded very depressed, and she sort of thanked me, and she said, that's all right. And by the way, magic words have been when you go to a hospital, say, I'm going to kill myself if they won't find a bed for you. But she said, that's all right, thank you for your help. And she went out and she committed suicide. My friend Gary is a minister. It was a cold, bitter December day. And the 5-year-old son of that woman said to Gary, the minister, if God loves me, why did he take my mother for Christmas? And he could not speak. That's what this disease is doing. And we all have a responsibility to do something about it, reduce the stigma, get treatment for these people. Get them into the ambulance like the fellow with the heart attack. Don't tell them you gotta wait 60 days. You gotta go to Alabama. You're gonna get treatment right here where you live. We're gonna treat this disease and we're gonna knock this thing out of the ballpark. And it's up to every one of us to do something. Thank you. I know it's late and everyone's tired, but I appreciate you guys coming, and this is fabulous. Just fabulous.
Thank you. Any other questions? All right, thank you all very much again. Have a good night.
Good night.